Welcome back. Well, with us today from Harvard Eye Associates, we have Dr. Karen Skvarna. Sorry about that. And we're talking about dry eye. And you know, a lot of times people hear that and they go, oh, my eyes are kind of a little itchy, a little dry, big deal. Well, it can be a very, very big deal. Am I right?
Yes, it can. It can be a big deal. It can be something that's as simple as just an irritation for an hour or two a day to something that can actually lead to blindness if not treated properly.
Wow.
Yeah, but that's an advanced case.
Okay,
Yeah.
so you brought along some slides we're going to look at today.
Okay.
And at its very basic form, what is dry eye?
Okay.
Is it more than, I guess I should say, we're not talking about, okay, it's kind of windy and dusty out today, and of course you have dry eyes for a couple of days. Almost everyone is going to feel that, little itchy eyes. We're talking
Correct.
about much more than that, am I right?
Well, dry eye is it's a disease diagnosis. It's a chronic condition, and oftentimes it has many different sources or causes. So one of the causes can be you just don't produce enough tears. I guess I should back up. So the tear film is really like an Oreo cookie. The outside is the oil. It prevents the evaporation of tears. In the middle is the aqueous. That's what we get when we cry. And then the bottom layer is the mucin, which keeps the tear film on the eye. And so dry eye often is due to a deficiency in one of those layers. But it can also be due to just not closing your eyes completely when you're sleeping. It can be due to having bacteria on the base of the eyelashes, which contribute to dryness. Some people take medications that lead to dryness, and some people have diseases like diabetes or Sjogren's or some kind of inflammatory diseases. So there's a lot of different reasons that a person will have a dry eye, and the most important thing is that we need an accurate diagnosis to know how to treat dry eye. So we're fortunate that at this point in time there's a lot of new diagnostic tests and there's new treatments available, and so that's what we were going to talk about today.
As far as someone developing this, and let's say they're not on a medication or they don't have diabetes or something like that, are you still able to get what I'm going to refer to as more chronic or severe dry eye? We're not talking about, as I said, it's kind of dry out today, you get a little dust in your eye. We're talking about more than that. Can someone still get that, and can it be any kind of an irritant that gets into your eye, maybe you don't even notice it at first?
Correct. And if someone has a temporary or a periodic dry eye, there's several over-the-counter drops. As long as you get something that doesn't say get the red out, most of them work pretty well. And you could try using those drops. But once you start using those drops 3, 4, 5 times a day and you're not comfortable, that's the time to figure out what exactly is going on.
Okay. Yeah. And that is the time, obviously, you want to get to your eye care professional and figure out if there's something more, if it's acute, right?
Yeah, for sure. So at this point, what I was going to talk about today is just some of the newer tests that we have. There's something called Inflamadry, which measures the inflammation in the tear film. And then there's also something called osmolarity, and then we have something called meibography. So our first one that we have, I don't know, we've got a picture of it. It looks like a pregnancy test. So it's actually, pink does not mean you're pregnant, but pink does mean that you have inflammation. And when we have inflammation, that guides us towards treating the inflammation of the dry eyes. Dry eyes has often been identified as an inflammatory disease, but some people have more inflammation than others. And if you have inflammations, we use things like steroids, or we can use those short term to get that under control, or we use things like Restasis or Xiidra, which are drops that you can safely use long term to help with the inflammation. Now, we don't want to put a person on a drop long term if they don't need that drop, and so this is a really nice test for us to use to guide our therapy. Another test that we have is something called osmolarity. And this is a machine that we test the concentration of the tears. So as the tears become more concentrated, that means that the dry eye is more advanced. And so it allows us to determine, is this truly a dry eye? Some people come in with dry eye symptoms But when we do the osmolarity test, it's not coming up as highly osmolar, and that will guide us towards looking towards things like an allergy or something else.
Okay.
So we want to know what we're treating before we start to prescribe
Obviously, you want to
medications.
know
Yeah.
what is causing this.
Yeah, exactly.
Okay.
So, and then finally, one of our newer tests that we have is something called mybography. And mybography is really interesting because it's a picture. So on this far side here, you can see these lines. It's very light. But what these yellow lines here are how the meibomian glands are. The meibomian glands are the oil glands. They're the oil-producing glands
Okay.
in the lid margin. And we want them to be long all the way through the lid margin. As a person develops meibomian gland
Okay.
disease, what we expect to see is when we push on these glands, olive oil. The oil should come out, it should move freely, and it prevents the evaporation of tears. But as a person develops something called meibomian gland disease, the secretions start to get a little cloudy.
Okay.
And they get cloudier, and sometimes they get to the point where it's almost like toothpaste. So
Wow.
it just doesn't come out, it doesn't prevent the evaporation of tears. And over time, you can start to lose these glands. So the glands start to shorten, and then you start to lose glands, and pretty soon there's no glands available. And if we have a patient who has severe meibomian gland disease, we don't want to treat that disease if they don't have meibomian glands, because it will be ineffective.
Right.
So this allows us to determine, do we have meibomian glands we can work with?
So they can actually disappear
They
over
can,
time. Wow.
and the goal here is to prevent that because that causes really severe dry eye.
Okay.
Yeah,
And once those are gone, you can't bring them back.
They don't come back.
Is that just a result of getting a disease or age, or
We
I mean
don't know.
losing these glands? I
Yeah.
haven't heard of that before.
We usually see this in older people.
Okay.
Although we are starting to see this in younger people who've been contact lens wearers for a long time.
Okay.
We're not exactly sure what's happening here. This is so new as far as the technology, so there is research ongoing right now. But we have identified that there's a problem here, and we're learning how, we're not just learning, we have been treating this for a little while now. So,
And if they completely disappear or close to disappear,
yeah.
how do you bring that oil? Does that oil back? Does that mean that someone has to take drops several times a day, every day?
Correct.
Okay.
And ointments, and that is when we usually see a very severe dry eye.
Okay.
Something that can cause, some people are debilitated by dry eye. So
Okay.
this is a very severe case, though.
All right.
Anyway, as far as treatment, we have some new treatments. Not newer, they're BlephX and LipiFlow and autologous or serum tears. The first one I was going to talk about is BlephX. This is an interesting procedure that has just started, not a very clear picture here, but what BlephX does is it treats blepharitis. Blepharitis is an overgrowth of bacteria. That bacteria lives in our skin.
Ah.
And what we do is,
Okay.
for some people, it likes to overgrow, and it causes flakes that flake off and go into the eye and cause irritation. It can, the bacteria really likes the meibum or the oil in the meibomian glands. Bacteria wants to stay where it is if it's a good, healthy environment, so they secrete something called a biofilm, and that biofilm is really difficult to remove.
Okay.
So the normal warm compresses and lid scrubs don't work necessarily for everybody, and when it doesn't work, then we use BlephX. And what we do with this is that we numb the eye, and we put the tip into a cleaner, and then we can clean very intensively all the way through the eyelid margin and all the way along the eyelash margin there, and clean that off. And for most people, it feels better immediately.
Okay.
This works really well for people if you see they have these little red rimmed eyes.
Right, right.
So it's really effective in that. So this has been something that we've been doing quite a bit. The other procedure that we have is something called LipiFlow.
Yeah, I've heard of this one.
Yeah, so LipiFlow occurs when the meibomian glands get blocked. And what we do is we just take the eyelid and put it into this little device. The device heats up the lid, and so you've got your eyelid, it heats up the lid and then massages like this. So it's massaging the oil out. And it's actually very effective in opening up those meibomian glands. And
that's
so,
great.
yeah, this has been a really good procedure. So we're fortunate to have a LipiFlow machine at our practice. And then finally, something that we were talking about where people get scarring sometimes. This is something, autologous tears are, they've been around for a long time. They have been used for burn victims, but we're finding that they're very effective when it comes to people who have severe dry eye that just does not respond to normal therapy. What happens is we send a person to a lab and they have blood drawn, and then the blood is spun down, and
Wow.
yeah, the serum, the clear part of that blood, is sent to a compounding pharmacy where they make tears, artificial tears.
Wow.
And those artificial tears have a lot of the factors that are really effective in helping the eye heal. And so a person will receive from the lab a packet that goes into the freezer, and they use these drops. Usually they last about 3 months, sometimes up to 6 months. They have to keep them in the freezer, and then they put them in daily, and we see very good results with these drops. So these are just
Interesting.
some of the newest things that are going on in dry eye right now.
Now, let me ask you, we're
Yeah.
talking about this beforehand, and I had mentioned that my father-in-law has severe dry eye. He went in and got it checked, and they said there was a scar on one of his corneas. I don't know
Right.
the
Right.
diagnosis further than that, or what kind of drops he's taking. And we're thinking, how did he get the scar? But you were saying just by having severe dry eye, you can get a scar on your cornea, right?
You can. Think about when you have very dry skin, your skin starts to flake off.
Right.
Well, the drier it gets, it can become chapped. And
Right.
that's really painful. When you have a very severe dry eye, it can become chapped. That's
Okay.
not the term we use, but that's what happens. And so it becomes so dry that you lose a lot of cells. And if those cells stay off the cornea for a long time and the cornea is exposed, that can lead to scarring. And it opens you up for infection too.
Okay.
So it's something that needs to be managed.
Now, if you get a scar on there, can it be reversed? Or is it noticeable in your sight, or?
It can be. Most scars in the eye are not reversible.
Okay.
A lot of times we're fortunate that these scars are not along the line of sight. So if your pupils are small and the scar is off to the side, you won't see that. If it's really off to the side, even when your eyes dilate, you won't see that. But if it's off to the side and your eyes dilate, some people will get glare or haze when they're
Okay.
driving a car. So that's something that can happen, and we do see that.
All right,
Yeah.
very good
Okay.
information. It's
Yeah.
nice to see all these advances here. And of course, the key is that one, see your eye care professional on a yearly basis. And if you feel there's something long term, you have a dry eye or whatever it might be, and it's
Right.
lasting more than 2 or 3 days, and normal over-the-counter drops, the artificial tears aren't helping, go in as quick as you can and get that checked out, because it can develop into a scar or something else.
Absolutely.
Yeah. Doctor, always good to see you.
Always good to see
Thank
you.
you.
Thank you so
I
much.
appreciate it.
Yeah.
And Harvard Eye Associates, of course, is just right across the way here. But as the doctor would say, and all the doctors from Harvard Eye, no matter who you see, make sure to see someone, especially if you feel there's a problem. Get it treated quickly.
Absolutely.
Good to see you.
Thank you.
We'll be right back.